Hey you guys, we are back. I am Dr. Cade and I am sitting here once again with Coach Cason, and we're going to continue on the theme with functional medicine testing, but this time, instead of trying to talk you into functional medicine testing, we are going to do our best to talk you out of it, right? Out of it. Do you have to test? You don't have to test. Do you have to spend a bunch of money? You don't have to, right? So let's go through a couple of different things, and Cason, I'll let you handle the first reason why not to use functional medicine testing.
Well, that would be if you can say that stress is the number one factor causing your symptom. And so we were talking earlier, and I gave an example, like, you know, you go to work and you're working with somebody that you just can't stand, and right when you get to work, you get to the office or on the drive to work, all your symptoms start happening. Maybe your neck starts to tighten up and you start to get that headache, or you got to go to the bathroom, or
you're not trying to say anything coming to work every day here. That's getting a little too real.
This is why I work here, because it's gone.
Oh.
My symptoms are gone. But no, if you can directly say that stress is causing this symptom, then there's no need to test. Let's address the stress.
I think that's such a perfect example, and hopefully you're connecting with that. If you can identify that, then address the stress instead of wasting your time and wasting your money trying to dig for something else.
Right.
Correct?
Yep.
And I mean, realistically, how many people you think out there, out of 10 people, how many people is that really the root cause of? Is stress it?
I would say a very high percentage of those 10.
More than the majority?
Absolutely, yeah.
It's pretty eye-opening, and something I'm learning from Cason every single day in practice.
Well, what we don't realize, though, is how much stress causes a dis-ease or a disharmony in our body. So understanding that is key. And
your book goes into that quite a bit in detail, doesn't it?
Yeah, absolutely. Yep.
Cool. We should have it right here for everybody to see, shouldn't we? Wired to Heal. Go check it out by Cason Lehman. So the next one is why not to use functional medicine testing is when you value action above all else, right? Yeah. So functional medicine testing typically takes a while to get back because they're using, relatively new techniques to get out these markers on the lab testing, right? Yep. So sometimes that's 2 weeks, sometimes that's a month, but usually it's somewhere in that time where once you submit the sample, we're waiting for those test results to come back, and then as practitioners, we have to figure out the best route of what we're going to do as a treatment protocol. Sure. So there's definitely a time frame there that, wasted precious minutes and hours and days to where you could have been doing something beneficial, right? Yep. So if you like biohacking, if you like trying things, if you like experimenting, and I would say above all else, if you are connected to your body and you are okay putting these things in and listening to those results.
Yep. Trying things different. And I would say in all of our functional medicine clients, we are giving some sort of breath work technique or getting out in the sun technique or something that's so easy to do that many people don't do to calm the body into the parasympathetic or rest and digest nervous system. So yeah, it's easy to do. You can do it now, and it makes a big difference.
And I would say maybe the last point about it is even if you do any of these tests, right, there's always going to be some level of experimenting, right? Sure. Just because, this thing is out of its normal ranges doesn't mean that by default, this is going to bring it back into play, right? Yeah. We're much more complicated than that, and just like we talked about previously, there's usually a perfect storm that gets us to this area that you're in, a symptom that you're dealing with, not just something that's out of range, right? Yep. So last one is budget of reasons why not to test, and we kind of alluded to this on the last video of why to test, right? Is if you've got a big budget, why not to test is if you don't have a big budget. Functional medicine testing is expensive, and again, not just the tests, but typically the protocols that come into play afterwards, right?
All the supplements
and food changes, lifestyle changes. We talk about a lot of things with people, right? Yep. And the reason why we do that is so that we can help you give every chance to get well and to stay well, right? Not just to treat the symptoms, not just to feel good, but going beyond that and creating health for a lifetime. So yeah, it can get daunting, but when you do it the right way, you set yourself up in your future for the things that you're after too, right?
That's it.
And so we'll typically try to talk people out of functional medicine testing if that is a budget is a concern, and we'd rather have you put that money into action, right, instead of waiting for the test. So, but at the end of the day, what we always say is we'd love to help you. We will always give you these different options, whether it includes functional medicine testing or not. And I think one of the things that makes us very different than a lot of the practitioners out there is once we present that information to you, we'll be here to talk it through, and it's up to you to make that decision on how you're going to move forward. And are there times where we kick back and when we kind of think it's really important to do something?
Sure.
Absolutely. You'll hear that, communication from us. But at the end of the day, we're simply the doctor. That means that we get to share with you what we know. You are the boss as a patient, for better or for worse, as we like to say, correct?
That's it. It's not our body, it's yours.
Yeah, yeah, absolutely. So I'm Dr. Cade, this is Coach Cason, and that was 3 reasons why not to functional medicine test. So can't wait to hear from you. Have a wonderful day, and we'll see you soon.